Finding the most suitable depression medication by John Paul Richards. Treatment is available for those suffering from clinical depression, a disorder that causes individuals to feel sad, listless, and disinterested in activities they previously found enjoyable. Cognitive behavior therapy or traditional counseling are options that frequently result in a positive outcome, sometimes in as little as 2 to 3 weeks. However, in certain cases, the aforementioned techniques alone are not enough to alleviate one's symptoms. In most cases, his physician may recommend an antidepressant. Types of antidepressants. There is a wide variety of such medications available in those with depression disorders, the most common which are selective serotonin reuptake inhibitors (SSRIs). Tricycle antidepressants are also an option, as are mammograph oxygen inhibitors and MOSIs. Along all the categories, SSRIs are considered the safest, although this does not mean they are appropriate for everyone. Dosage adjustments. Certain physicians prescribe more than one antidepressant for an individual, although other doctors feel this course of action is not wise. One must discuss such options with his or her personal physician in order to determine which approach is more suitable. The dose described will vary from one patient to the next, and in most cases the dosage will need to be adjusted one or more times in order to get the patient to achieve optimum results from the medication. As a general rule, a doctor will attempt to prescribe the lowest dose possible that will still bring about the desired results. One should never attempt to adjust his or her dose unless advised to do so by a physician. Patients should also refrain from mixing old and new medications if the doctor has switched them from one to another. It is also essential that patients understand that tranquilizers and anxiety medications will not treat clinical depression. Although they are sometimes prescribed in addition to an antidepressant for those purpose of treating other disorders, there will be nothing to do alleviate the symptoms of depression. It is never wise for a patient to replace his or her antidepressant with a drug that is classed as a tranquilizer. What are the side effects? As with all medications, there are side effects associated with antidepressant drugs which can be common in nature. The more common side effects of such medications include dry mouth, headaches, and constipation. If the latter occurs, of fibre is one's diet is typically recommended. Blurry vision is also a somewhat common side effect of antidepressants. However, this effect is usually temporary and will dissipate with continuous use of drugs. Insomnia is also a common side effect, but similar to blurred vision, it is also temporary in the majority of cases. As with all medications, one may experience an allergic reaction to a specific antidepressant. The symptoms of such a reaction include hives, shortness of breath, a sudden unexplained rash, itching, wheezing, and anaphylactic shock. If symptoms of this type occur, one should stop the medication at once and contact his or her primary care practitioner. Severe or prolonged side effects should be reported to one's doctors, who may decide to change the dosage or switch the patient to a different drug. Any concerns patients have about their depression medication should be discussed with a licensed medical professional. If you still have issues with depression, if you are on medication but you just want a little clarification, if you visit my website in www.jsdirect.co.uk/beat depression, I'm giving away a free gift just to help the people who were feeling low and depressed, which I have done myself, which I wrote this book after I did a lot of research and just to clarify everything that you need. If you want this, it's free of charge for yourself. Or if you know anybody else who's suffering and needs some help, please direct them to this page, as you can see on the screen, www.jsdirect.co.uk/beat depression.